when the body moves, it releases chemicals that make it happy. It releases endorphins, it releases dopamine, chemicals that make the body happy. But when we move, we keep our joints lubricated, we burn calories, we keep our weight down, regulate our sleep wake cycle in that by being active and busy, you do the things you need to do, but you tire yourself out such that at the end of the day, your body is ready to rest.
Hello, everyone, and welcome back to Trauma, Training and Transformation, the podcast that explores how movement heals the mind. And today we've got a really great special guest, Dr. John Gillis, who is situated in Halifax, Nova Scotia. He's a medical doctor. And today he's going to share his insight both about trauma, healing, burnout, but also why movement and routine and listening is far more important than we realize. This is not a clinical lecture. It's more of a human conversation. John, thank you for joining us today. And for the benefit of the audience, please introduce yourself.
Yeah, thanks, James. It's happy to be here. Where to start? I have been practicing medicine, I guess, since I got my degree in 1999, which is longer ago than I care to think about. Did family medicine for 2 years and then emergency medicine. Took 3 years between those two things, and I've been doing, I guess, a mix of things ever since. Continue to do part-time emergency medicine. I run a chronic pain clinic, occupational corporate health clinic, and it's by default, which is how we know each other from the rugby world. I do a lot of rugby-related and other sports medicine. So around a lot of different things in medicine, from the acute to the chronic, with an intersection into sports, movement, and activity, and all those things. So, like a little bit of diversity in life, and that keeps me going, and try to keep other people going as best I can.
Well, thank you for sharing that. And looking back on your experience as a doctor, how do you feel when you reflect on your career? What moments do you think helped shape you in the way that you practice medicine? And also, how you share those knowledge and experiences within the rugby community, but just people at large? How do you interact with humans about trauma, but equally about the way we need to listen and talk to each other?
Yeah, I think the first thing is it's easy for us all to, forget that we are all, in fact, human, and things don't always make sense. Illness is not just the sum of what's happening with the body, but of how the mind interacts with it and how we feel. Sometimes things that seem very simple are not, and sometimes we can get confused by what's in front of us because of that intersection, and sometimes the complicated is very simple, in fact. I think what you asked me what shaped me the most, I think it's, you know, some key moments when you saw you could really help people, and maybe some key moments when you felt helpless. I had had a moment when I was on cardiac surgery when I was a student, which doing basically nothing but following people around, but taking care of the little things and sewing up legs. But had a guy, older gentleman, well, at the time for me, probably in his 60s now, a lot closer, but, started crying one day, and like, sir, why are you crying? He's like, well, I used to live in the US, and even though I'm Canadian, and if I was there, I wouldn't be getting this procedure. I wouldn't be able to afford it, and I'd probably be dead right now. But here I am in Health Sciences Center about to get, one of the most advanced robotic procedures in the world, and I'm treated like a human being because I am a human being, not because I have fancy insurance, not because I can pay for it. Moments like that, are gratifying when you see yourself making a difference. Even though, in my, me personally at that moment in time, had very little to do with me. It was the, state-of-the-art facility and these amazing surgeons I was working with. But it went to show that, there's something meaningful in our system that, we're able to be a part of. And, as you moved along in the system, there's always a few moments like that where you really felt like you helped somebody. There's lots of those. Probably on the other side of things, probably the most helpless I've ever felt. I was also a student, pediatrics, and some kid came in, maybe a 3-year-old needing resuscitation. I was sent to talk to the dad to get the story, eager and earnest, got the story, how terrible it was, the fall at the playground, this sort of thing. Came to find out later that, that was all bull, and it was a child abuse case. And it was horrible to see what had happened, and, how hopeless and helpless I felt in that moment. But again, the good news is, the system worked. That child did well and was taken out of that situation and was on the way to healing mentally and physically. So a lot of moments there. And I think the biggest thing is not to become cynical and detached from it, which is easy enough to do, particularly in an emergency room where you feel like you're underwater all the time, you're behind, there's people all around, it's chaos, there's no order, and you're doing your best, but, sometimes you feel like you're not keeping up.
Oh, thank you for sharing that. If you look back at the training that you got early years as a doctor, do you think that helped to shape and give you the skills, the human side of being a doctor, or would that come along with life experience?
I feel very fortunate, and, everybody has a different experience, but I did most of my training in London, Ontario at, I was in the University of Western Ontario. Now they just say Western. But we had, very good people, around us, both my classmates, the interns, the residents, and the staff people who really made an effort to teach not just the facts of medicine, but the human component and the decency of medicine is that you should always try to take time to be decent to people, to put yourself in their place and to think about what they're experiencing. And again, as time moves on and as things get busy and as chaos reigns, that can be hard to do. But, I feel fortunate that was always front and center in the teaching in those days. And I still think largely is important in our system, but, things change with the changing philosophies, changing financial realities, political dynamics. So it's sometimes hard to keep one's eye on that ball.
Because everyone's different, everyone's experiences are different. But how do you think trauma actually presents itself in people? Does it still fit along the medical categories as what you expect to see?
Yeah, it's interesting when we talk about trauma in medicine. I mean, when you hear the word trauma as an ER doctor, you're thinking about a car wreck, broken bones and that sort of thing. But, for the most part, it's much deeper than that. And, the trauma that is probably most widespread is obviously, I think what we're talking about is emotional trauma, life experience, things that people experience in their lives personally, whether through their families, through their jobs, in school, and, hard times, how they're affected by these things. And probably something that we still don't do a good enough job of teaching people to recognize. When someone's in the hospital presenting with pain or sleep disorder or restlessness or whatever, well, they may not have an acute medical condition at all. It may all be related to what their experience has been or what they're trying to get away from. It's very important to remember to slow down and not think about a textbook and think about the person that's in front of you. And that can be tough. Again, middle of the night, busy place, alarms going off. And sometimes people that are traumatized or having a tough time are not very nice to deal with. They manifest their trauma by acting out at, either people around them or sometimes at us, sometimes at medical professionals. And it's, you have to try to take a step back, slow down, and think about that as you try to help somebody.
And for many people, the toil of trauma, for whatever exposure they've had to that, is often carried the weight of that on the body rather than in the mind. And it's only later on in time where the weight gets too much that the mind seems to show the symptoms of that. In your experiences in A&E, you must have seen lots of situations that echo a lot of issues, but also in your role as a doctor with the rugby teams, you've seen players with injuries that have been quite horrific for them. Players just want to get up and play. And it's what message you have for people who should just maybe take a step back and just accept where they are and deal with that time?
You see both extremes. I mean, we do see people where, their personal life traumas have consumed them and they are mired by it and in it. They can't come up from it. And in some cases, it becomes their state of being. And that, you want to help people fix whatever you can, but also to try and be honest with them and say, look, I don't think the fact that you've been here 25 times in the last 60 days for your non-specific abdominal pain is, you've had 4 CT scans, you've had a scope, there's nothing physically wrong. That doesn't mean there's not something wrong with you, but to try and turn the conversation, back to help people, address what might be the underlying cause. And that, that's hard to do. It's not saying what you're feeling is not real. It's just saying, I see this in the chronic pain world, probably more than I do in the A&E, is that your pain is real, but another CT scan of your back or another surgery isn't going to fix it. It's related to other stuff. Now, again, with athletes, you almost see the reverse. You see, I'm fine. I'm like, no, you've had 4 concussions in the last 3 months. You say you're fine, but we're seeing, X, Y, and Z objectively, you're more emotional, your response times are down. The facts are there, but you're trying to push through when you shouldn't because it's what you feel you should do and it's what your identity has become. So, people can start to identify as being sick. They can also refuse to give up on their high performance life, even though their body has slowed down. So we see both sides of that people they become mired in a spot through no fault of their own that they can't get out of. And you see people who won't give up on, I'm a high end athlete. I'm going to keep going, even though I've had multiple concussions, multiple shoulder injuries, whatever the case may be. And it's sometimes hard to deal with both extremes because they're both quite tricky.
Well, completely. And I've been lucky to see some of the excellent work you've done by providing support to high performance rugby athletes in Nova Scotia. And we're going to touch a little bit on the Atlantic priority later on. But I think every player, coach, individual in the rugby community in Nova Scotia has a lot to thank you for, and I do appreciate your support on that. But outside of sport, do you often see the physical symptoms visualizing themselves as a messenger for maybe longer or deeper psychological or emotional strain?
Oh, absolutely. I mean, I mentioned, I run a chronic pain clinic. I see a lot of it there. You do see it in the A&E, but, people have pain for different reasons. Sometimes there is a problem in their back. It's their disc, or it's their neck, or it's this or that. Sometimes, pain is a manifestation of stress, trauma, depression in the context of fibromyalgia. And one of the key things to address when, just using pain as an example is, yes, you may have an objective finding, but what else is going on? How are you doing emotionally? How are you coping? And again, we see the minimalists, the people who have 3 herniated discs, can barely walk and are like, no, mate, I only want to take Tylenol. And then you see the other side where people have gone all in. They'll take anything you give them, and it's become an emotional hole for them. They can't get out of it, and they'll take any chance, any pill, anything given to them, which may actually make their situation worse. So finding that balance. So little things like, how you sleeping? Well, I'm here to talk about my pain. Sure. But if you're getting 2 hours of sleep at night, you're a mess emotionally. You can't function. You can't think. You can't focus on the little things that you can do. Let's see if we can get you sleeping in addition to tackling your pain. Who do you talk to about how you're feeling? Because all these things are irrelevant. If you have a bad back and you're sore, but you have a great support network and people help you go do things and help you around the house, you do much better than the person who has no help, has no support, has no one to talk to, and just gets into a cycle of overeating, inactivity, weight gain, which in turn makes mood worse, makes sleep worse, and makes whatever the condition is, in this case, pain, much worse. And we see a lot of manifestations of that in the ER with, a lot of chronic conditions, but it's mostly pain. We see people all the time with unexplained headaches, belly pain, back pain, or people, who come in for what seem like relatively minor things, but, is it because they're lonely or have no one else to talk to or no one else to help them? It often is. So again, trying to pull apart, is there a physical, organic cause to something, and what is the intersection with someone's lived experience with that condition or other conditions, and how it affects them all in totality.
Thank you very much for sharing that, John. This podcast is built around one idea. Movement is not about performance. It's about regulation, identity, and recovery from both evidence and lived clinical experience. What role do you think physical activity plays in mental health recovery?
Look, I mean, you and I could go through papers and evidence and all the things, but, just from what I've seen, and I know what you've seen, when the body moves, it releases chemicals that make it happy. It releases endorphins, it releases dopamine, chemicals that make the body happy. But when we move, we keep our joints lubricated, we burn calories, we keep our weight down, regulate our sleep-wake cycle in that by being active and busy, you do the things you need to do, but you tire yourself out such that at the end of the day, your body is ready to rest. So, that's what's meant to happen. And, I think a lot of people, when we talk about physical activity, they think I have to be, running 5 or 10K a day and in the gym throwing around a lot of weights or, all these things. And it doesn't have to be that. And, I think my view has really shifted as an old rugby player, and, intersect it with the things I do professionally. I used to go beat the crap out of myself 4 days a week 3 or 4 days a week on a rugby field and do very little in between. I wouldn't stretch. I wouldn't walk. I wouldn't do anything else. Wondering why in my mid-30s I started pulling muscles all the time and I just wasn't recovering. But, started to do more of those things, lifting lighter weights, really walking, put together for myself that was helping me do what I wanted to do, which was continue to play rugby poorly into my 50s, but also, just to feel better, to not gain weight. It's what I say to people, do whatever it is you can do that is sustainable for you, that you don't hate doing. And that there's no cookie cutter answer to that. In my case, I like to tell the story and I'll clean it up a little bit. But, a couple of years ago around this time, I was really struggling with my right knee, after years of playing sports and, it was painful, it was swollen. And, the result was couldn't run very well. And, when you don't run, you don't move, you start to lose muscle and just made everything worse. So I went to see one of my orthopedic buddies and, told him, I think this, I think that. And he looked at me and I checked it out. He said, we'll get a scan to make sure. But he basically said, you need to harden up and lose 30 pounds and you'll be fine. And he was absolutely right. Now, he knew that he could say that to me and I would respond to that. That may not have been the way to say it to some people, but in his own way, it was the best message for me. And what I started doing was something I'd never done before, probably fairly ADD, undiagnosed. I went to the gym, sat on a sit-down bike with my headphones in front of the television, watched highlights, watched something else, listened to music, and started pedaling, 4 things, tried to keep my brain occupied. And that worked. I started to hey, I just biked 10K. I didn't notice I did that while I was watching rugby highlights or, some abomination of news from the US and started to feel better, started to feel a little bit lighter and, started to say, well, maybe I can go back and do those knee extensions that I couldn't do anymore because they hurt too much and, started to rebuild it. But, it wasn't a powerlifting, escapade here. It wasn't I'm looking to be in the next triathlon or the next CrossFit competition. It was, I'm turning into a fat late 40s obsolete rugby player who doesn't feel very good and need to turn some things around. So that was just what happened for me. But the point is finding something that you can do. And if that something is walking down the street twice a week, if that something is lifting a few light weights, whatever it is that can occupy your time, your mind, and your body is so important, not just for physical health, but for the mental health that clearly goes with it.
Of course. And people who are suffering with any form of mental health should get the appropriate advice and support from the GP. And often medication or counseling is often prescribed because it's the appropriate action for that individual. But often people see movement or physical activity as an optional therapeutic tool rather than essential. Why do you think that is, and what do you think we can do to change that message?
I think you highlight, a couple interesting things. First of all, I think in some cases, particularly when you're dealing with men who can be stubborn and, worried about taboos or worried about being stereotyped, they don't want to admit that they have a problem, that, maybe they're depressed or they're traumatized or for whatever reason related to that. And they won't consider medication because it means they're crazy or they're bad or something's wrong with them. So, on that point, sometimes we do need to consider medications. Having said that, I think in society, we went way too far with, someone, the Toronto Maple Leafs lose 3 in a row. That's inevitable, but it makes me feel bad. But that's not a cause for chronic depression. There was, I think, a period in time where we hit a low point where, with teens and adults, you're having a few bad days, we just throw a pill at it. Pills have a role. They're important, and we need to reduce stereotypes, particularly in groups, like middle-aged men who, tend to be very reticent to talk about things and to seek treatment. Having the flip side of that is throwing pills at people is useful in some cases, but we have to look at all the other things, which is sleep, diet, and movement. And I think, to your point, people don't realize that one of the best things you can do for yourself is to move, is to make your body active, to release those chemicals, to keep your weight down, and to create a sense of well-being that, works into part of a broader plan to make people feel better in general. But it's very overlooked and very forgotten. And I think it also can be a stage of life thing. I mean, I think you'd appreciate this. I mean, as someone who's still around sport and is still quite active, I have a lot of friends, who, in their mid 30s just, oh, well, I'm done with whatever it is, rugby, soccer, and then they just stop entirely and their general health and well-being declines. Doesn't mean that they have to continue to play rugby or be at the pub every weekend slugging pints, but you do see folks who have stopped taking care of themselves physically, and it affects their general well-being overall, even in the absence of trauma. It's good advice in general for everybody, whether, you just living your life, quote, normally, whatever that means. But especially if you've had difficulties in your life, keeping yourself moving, keeping active helps you physically, but it also connects you to people and to activities, all of which are quite important.
Of course, and you'll have a lot of people who, you mentioned yourself going through an injury and getting the advice, but you'll have a lot of people who maybe disconnect completely from physical activity and become sedentary in a sense and lose that enjoyment and that motivation to be involved. So how do we, us as professionals, I guess, and especially someone in your position, introduce movement where it's used as a positive tool rather than with added pressures?
Yeah, I think it's, if people are in a situation where they can't do the activity that they used to do, they shouldn't just retreat entirely. Find something that you can do. It's back to the same message. If you can't run, try a bike. If you can't do that, try swimming. People that I never thought would try yoga are rocking it now and, feeling better about themselves and, just doing things. But it comes back to encouraging people professionally. But I think, we need to do it as brothers and, fathers and husbands, mothers, all that stuff. Just encourage people around us to do stuff, to get out there and be active. And I guess, switching gears a little bit here, but, I have teenage kids, one who is crazy active, the other's a little bit less active, but across the generation is the omnipresence of media and phones and social media such that, people will spend a lot of time doing that, playing video games and not getting out. And it's easy to sound like the old guy curmudgeon or anyone who's listening to this will laugh hearing me talk about that because I spend too much time on my devices. Carving out time to be active, to be away from a screen, to use your body, which helps your mind is critically important, and again, but it's not just kids. If you sit in an airport or sit in a lounge somewhere or sit in a restaurant, even in the gym, and look, I do it too. I'm not going to be a hypocrite. I'll finish my set of whatever I'm doing, shoulder presses, and I'll check my phone. And if you look around, 99% of the people, that's what they're doing as well. And again, it's being aware. I have to talk myself through it, again, not to be a hypocrite. I have to sometimes say, put the darn phone away, do your workout. When I used to train with a local coach here, Sam, he would say the same thing to me. Put your bloody phone away and let's do the workout. You can talk to whoever that is later. And he was absolutely right. We need to get into the mindset of sometimes we need to take time and, do physical things that are good for us. But also it can be, it's peaceful to, turn it off for a second. But sometimes that's hard to do when you're so used to being hyperstimulated all the time, which many of us are, particularly younger generation.
Yes, and the use of mobile phones and the social media generation has an impact on our mental health. And you touched a little bit there about men, that cultural expectation where men weren't expected to ask for help, or the stigmatism of once you show weakness, it can carry a lot of, particularly when you want to ask for help, but the expectation is you just get your head down and go through it. How can we change that as a society? Give people that confidence that they can, yes, use movement, but be honest with themselves and ask for help when they need it at the time.
Yeah, I think it comes back to conversations that are professional, when, as a healthcare provider, when I see people, to try and have those conversations with them that you need to take care of yourself, you need to reach out, but also, again, human to human, when we're talking to our friends or family members, to encourage them to look for signs of, trauma, of decreased mood or down feelings, and say, hey, you okay? What, I'm here for you if you need anything. It's not a sign of weakness. It's a blip. It's something you'll get through. And we see it with physical things too. I mean, comparing breast cancer screening and awareness in women, to prostate cancer screening and colon cancer screening in men. It's gotten better with some of the great efforts like Movember and such, but, dudes don't want to talk about it. Whereas, generally speaking, women are much more open, aware, and activist in not only dealing with these things themselves, spreading it to their sisters and making sure that people are cared for. And I think we can all do a better job of that, of whatever health metric is required, whether that's counseling, whether that's going to see a healthcare provider, or just getting off the couch and going for a walk, a run, or something to encourage movement.
Of course, and your job as a clinician, but also coaches and leaders in society, how can they help support, especially young adults going through maybe some form of trauma or recovery from injury, to work with identity rather than against it when supporting the individual's recovery?
Yes, I mean, these recoveries are complicated. I mean, and it depends who you're dealing with, but teenage athletes are dealing with massive changes in their bodies. They're dealing with changes in their social dynamic, and they have an injury. So how they respond to that injury is related to all those things. And I think awareness of a person's situation is very important. And, understanding injuries is important too. I mean, I think we've gotten way better at that in a lot of ways in sport. In rugby in particular, one of the prime examples, as you know, is recognizing head injuries. When you and I played, and, we got a knee in the head, it was pour some whiskey on it and carry on. This process that has, reached down to athletes themselves, to parents, to coaches, to referees, and at the rec levels and even at the competitive and even semi-professional levels. We don't necessarily have physicians there, but we try to build a network where we can help people, identify and, manage a problem when it happens and before it gets worse. But, that applies to all of this, mental illness, physical injury, a concussion, whatever the case may be, whatever someone is going through, the concept of community in sport is important, but it applies to all of those things. It's not just, show up, train, and get the best people on the field. It's trying to make sure, that group is as healthy as it can be.
Of course, and many injuries in sport or in life come from the term burnout, overload or just busy lives. Burnout is a phrase that often used, but do we really know what it means? Particularly in high pressure environments, be it in sport or in the business world.
Well, that's right. I mean, the pressure can come from a lot of different places. It can come from relationships. It can come from work. It can come from what you're trying to do in sport. And, you don't know which is the release valve for the other, or if there is a release valve. I mean, I often say to people, at my age and in my 50s, where, I'm playing Div 2 rugby and, happy to just be on the team sheet on a Sunday, whereas 15 years ago, I'd be in a rage if I wasn't starting for the Prems. But, what it allows me to do is, to train and play is to get that physical release, that release of endorphins, of tension. That is, I'm not having to think about the other 50 things in my life. And that's just me personally. Everybody experiences it differently. But, that's why it works for me, just to get out there and get a run around and not to have to be thinking about the other 42 things. And that's really important. And I don't think we think about that, just how much that release on a simple mental and physiological level is important.
And part of that is actually listen to yourself, but when you're speaking to friends or peers, is being confident to explain what's going on, be it an injury or struggling through some form of trauma. So how powerful do you feel listening is as an intervention?
It's really important, I think, because again, I've alluded to earlier, people respond in very different ways. You get people who will shout about what's wrong with them, and in some cases overstate what's wrong with them. Make sure you make a proper analysis and understand why they're feeling the way they are. And in some cases, it's not that bad. We're going to do the testing. They're anxious, but maybe they're anxious about something else in their life. And then you see the other extreme, there's a bone through the skin and, there's blood spurting everywhere. And the person's like, oh, I'm great. Just, put a little tape on it, put me back in. The minimalist, the person who will always downplay the injury, try to play through it, try to push through. And again, it applies to the physical and the mental. There are people who, they're always fine. Your father passed and I just lost my job, but I'm great. Don't worry about me. I'm great. And then on the other end, you'll see people who with the smallest thing, what may seem to us as the smallest thing, but isn't to them, to be clear, just decompensate and can't cope. So understanding those variables on both sides is important to try and do your best to help frame a personal physical injury or an emotional injury in the best way. And also, and this is the tough part, you have no choice but to apply your lens and your approach to it, but all remembering that that's not always right. Just because I have a certain experience and I'm trying to help you, keep in the back of your mind that, maybe I have it wrong. And if it's not working, maybe I should ask someone else what they think.
And in your professional life, being a doctor, has there ever been a time where you've seen moments where simply by being heard, that's changed the direction of recovery for an individual?
Oh, absolutely. I think probably pain is the best example. I mean, I have people patients who are very, factual. They walk in, I want my injections, I want my prescription refilled, I'm doing fine. My needles lasted me 2 weeks. Peace out, see you in a month. And then the other side, there are people that the main reason they're there, even though ostensibly they're there for a prescription refill or, a shoulder injection, is they really want to talk about what's happened with them and how they're feeling. And it's important to get out of business mode sometimes and just to sit there and listen and let them say what they have to say, even if you feel in your own mind, through your own bias that you bring, that it may be irrelevant, because it's not irrelevant to them. And, again, coming back to reminding yourself of, I may, from time to time, we're all human, feel like rolling my eyes at what I've probably heard for the fifth time. But this person, in telling that story, in relating how they're feeling, it helps them cope and it helps them ground themselves and feel better. And that's okay. Finding those boundaries and finding the margins where, no, you don't need to come and spend an hour telling the same story every week. That's not helpful. You're ruminating a bit. But if you need to talk, then that's okay. Again, balance. And I don't have all the answers to what that balance is, nor necessarily does the patient, but coming together to find that balance is where it's most effective, I would say.
And when you obviously in your role as a doctor, you do the call-ins on radio each week. And what I find really warming really is how many different people from different walks of life ring in for medical advice, and your grounded and calm approach to supporting that is incredible. So for anyone listening to this podcast who now maybe feels stuck physically, mentally, or emotionally, what would be one realistic step that you would advise them to take in relation to movement, listening, in relation to towards healing themselves?
I think it's what I said earlier is start simply. You don't have to be an athlete. You don't have to have a big plan. Something that you like to do. If it's walking to the store, if it's walking around your living room, if it's doing a little bit of light work in the house, going somewhere with a friend, finding an activity that works for you and doesn't feel like work. And everybody can find it. And again, going along with that, I've come back to pain a few times here. It's relevant as it pertains to sport as well. Get someone feeling a little bit better with their sleep, with their pain, with their mood. And then they're much more likely to say, okay, you know what? I actually do now feel like I can walk to the store. Whereas if they're not sleeping, nobody's talking to them, they're in a lot of pain, it's just much easier just to sit on the couch. And what happens then? And this is the vicious cycle of mood, pain, and trauma, is that as you feel worse, you do less. You do less, you tend to want to eat more. You gain weight, you lose muscle mass, you lose muscle tone. What happens then? Your mood your mood declines further, your pain tends to increase. So just battling even that basic decline is very important for people to establish modest and basic goals themselves, or with, friends and loved ones. Here's what I want to do to help me keep myself active mentally and physically at whatever place I'm at right now. And it helps prevent a further sink at a minimum if you can stop and then slowly start to raise the bar. And, the goals can be whatever they are. We see some remarkable success stories of people who go from being inactive and unable to move and overweight to complete turnarounds. But that's not going to happen for everybody. But if we can get people feeling better about who they are every day, they want to get up and do things, movement is a big, big part of it. And implicit in living and being busy is you got to move, right? I mean, you can't take a taxi everywhere, even though I tend to try. You got to walk down the street. You got to walk to the field. You got to, walk around the supermarket. It's just being able to do those things. And I think we forget about helping people get there. And that's important.
John, thank you very much for sharing that. As one of your roles in Nova Scotia is the founder of the Atlantic Privateers. So what does 2026 look like for your organization this year?
Yeah, so the Privateers are originally a men's and now a men's and women's high-performance rugby program to help advance players from our region in Atlantic Canada to give them hopefully a chance to play higher-level rugby, ideally professional and international rugby. And, we've seen players from the region play for Canada at both the men's and women's level, and some amazing recent success, particularly for the women who made it all the way to the final of the World Cup, and our men have qualified again. So our goal is to give those folks a chance. Our season ahead is quite a diverse one. We've got a game in BC in February, game in Boston, Mass at the end of March against the Major League Rugby champion New England Free Jacks, which is going to be quite interesting. And then back home to play Eastern Ontario twice. And then we're heading to Bermuda to play the USA South and the Bermuda national team. So quite a mixed bag on the men's side. Our women are playing twice in Ontario, and they'll be home against USA South. And we're looking for some more games for the women's team, which again is a bit newer and just getting up and running, but we're very pleased to have that gender balance and the the amazing energy that the women's program has brought to the club. So we're excited about it, and again, it's trying to provide opportunity for people to get out there, play, and do good things in rugby.
Oh, that's great to hear, and I'm sure with all the hard work going on behind the scenes, staff, players, it'll be a great success. And good luck to everybody involved. John, thank you very much for joining us today. It's been incredible sharing this podcast space with you, listening to your in-depth knowledge about movement and also mental health. If this episode resonated with you guys, please, you can find this podcast on Apple, Spotify, or Amazon. Please like and share. You can also watch the video on YouTube on my channel, James Alder at James Alder 003. Please like, share, and subscribe. It will really help share this message with those who need it. If you want to carry on reading, you can find my Substack at Transformation Through Training. I provide weekly newsletters to help you use movement to heal the mind. And also, if you want to help me continue with these channels, you can buy me a coffee. The link is in the description box below. This podcast is about movement. Movement is not about fixing what is broken. It's about reminding the nervous system that it's safe to live again and safe to move again. Thank you for listening. This has been Trauma, Training and Transformation, exploring how movement heals the mind.